1 in 3 Americans have a metabolic syndrome, which is the precursor to a chronic illness. We firmly believe at PreventScripts that we're leaving a very important stakeholder out of this conversation, and that's the primary care provider. Well, good afternoon, everyone. I am so honored to be here with you all and such talented entrepreneurs in the StartUpHealth portfolio. My name is Brandi Harless, as Logan said, and I am the CEO and co-founder of PreventScripts. And we are on a mission to simplify healthy living for all patients. I don't often have to spend a lot of time here because we all know there's a big problem with chronic disease in America. We also know that there are hundreds, if not thousands, of products and companies out there trying to solve this problem. Most of the time, they're working with or within health plans, self-insured employers, or even in the consumer fitness and wellness industry. But even as we stand here today, the needle has barely moved, and 1 in 3 Americans have a metabolic syndrome, which is the precursor to a chronic illness. We firmly believe at PreventScripts that we're leaving a very important stakeholder out of this conversation, and that's the primary care provider, which is why we've created an EHR plugin for primary care providers to identify, triage, and intervene with their patients. We do this by assessing risk, then matching patients and recommendations for best outcomes. Once a patient is enrolled in one of our programs, they receive a starter kit in the mail, and then one of our consumer-friendly apps leads them through one of 3 of our interventions: preventive counseling, remote patient monitoring, or tobacco cessation education. Our dashboard actually monitors the clinic's use of the PreventScripts platform to make sure we're finding those insights for optimizing the clinic implementation, but also revenue generation. Here's the thing. There's a lot of money being left on the table in healthcare in general, and we know there's some opportunity here to focus on this group of patients. In any given patient panel for a primary care provider, you're going to see on one end this healthy group of patients that don't take up a lot of time, right, from their clinicians. On the other end, patients that are taking up a lot of time from our clinicians who have multiple chronic conditions. And then there's this group in the middle we call the rising risk that could benefit from just a little bit more care. And because of technology, we're able to do that without burdening our practices. Here's a scenario for you. 110 patients enrolled in one of our programs, 100 assessments completed every month. This is around $17,000 in additional MRR for our customers through health insurance reimbursement. And after paying for PreventScripts, that's a 4-to-1 ROI every time. So this is a win-win situation for our customers. We've unlocked the health insurance reimbursement challenge and the clinical workflow challenges, and our traction is starting to show it. We just ramped up to 12 providers over 4 clinic sites using our platform. We've assessed over 2,800 patients, triaged over 1,000, and every day we're onboarding patients into one of our programs. Month over month, we're seeing more assessments completed, more patients enrolled, and more patient excitement and interest in what we're doing. Our ultimate goal is to get 1,000 primary care providers utilizing PreventScripts by the end of 2026. And using that little scenario I showed you earlier, that's $42 million in ARR for our company alone. We've put together the team that we know can meet this mission. Dr. Natalie Davis is a practicing 20-year pediatrician, was on early physician advisory boards for companies like Doximity, who just had an IPO. She's always been known as a futurist and a technology doctor. Our other co-founder, Jay Campbell, is our chief technology officer, has had a successful exit on his own, and provides that deep technology experience we need for our team. And then myself, I have a background in public health and clinic administration, and most recently had the opportunity to serve my community as mayor, and was able to attract over $150 million in public and private investment to our community, earning some awards from the Kentucky Medical Association and also the Foundation for a Healthy Kentucky. We've put together our dream team of advisors and a partnership with the University of Kentucky to always be thinking about what do we not know that we need to know, and to de-risk this approach as we move forward in our growth phase. We have done a lot with a little. With only a $500,000 in pre-seed investment, we've gotten this far, and we are excited about the next phase of this company. And so that's why we're here today, to enlist our next round of partners, either in our $1.5 million seed round or to help us find the next 100 providers to use this platform in 2023. thank you all, and I look forward to your questions.
Brandi, that's awesome. I appreciate that. I love that visualization of the rising risk and how it wedges in between these two areas that people have historically focused on so much. So very smart. As you know, we were able to do a great interview recently with one of your early clients, Dr. Wilson, and it got me thinking about the lessons you learned doing a clinical workflow implementation. So I wonder if you could speak to just kind of what some of those lessons learned were implementing into an actual clinical workflow.
Yeah. Well, I think as healthcare people, we came to that problem thinking about it first. So we didn't build a technology and then try to shove it into the clinic workflow. We actually built an MVP, tested it with our customers, and then went back to the drawing board and solved for all the edges where we caused pain. So I think that approach on its own really helped us find an inherent solution to that integration issue. I'll tell you, the secret sauce is that it's not that profound. Right? We didn't have to use a ton of technology to get there. We had to use what our customers were telling us. And then also the EHR technology that's already there and available for us. So we kind of found that round peg in the round hole, and then we're able to fit that in together.
Yeah. You mentioned that 1,000 provider number. What's your customer acquisition strategy?
Oh, yeah. Thank you for that. We're in the industry. And so we find, obviously, this is a relational business. And especially for clinicians taking on new products, it's definitely a relational business. So we are very active in multiple different professional organizations like Kentucky and Tennessee HIMSS. That's our backyard. These are our people where we know that we can find traction with first, and in fact, have already. So getting involved in those industries, the medical management associations, making sure that we're there, being a part of the conversation. And then also utilizing LinkedIn as an approach. Recently, we found a lot of success with that, being able to find those office managers and clinicians that are interested. But ultimately, let me say this. We know that the growth opportunities are within large groups and within large systems. And so our idea is to do this. Start with these independent practices, get some traction there. They have short sales cycles. They're able to say yes a little faster, but find that pilot champion within the system to be able to do a project in the system and then grow from there as well.
Awesome. We got one question from the audience, and we have only 1 minute to answer it, but have you included any internal medicine teaching programs in your roadmap in these 1,000 providers like the American Board of Internal Medicine?
Oh, no, but that's a great idea. We have that partnership with the University of Kentucky. So we've started down sort of that path, but I'm loving that. Absolutely. Thanks, Dana.